Good afternoon. My name is Dr. Roth, and today we're going to discuss curvatures of the spine, the natural curvatures of the human spine, of which there are 4. And I'll use my model here to show you. You have in the neck, cervical lordotic curvature, in the mid-back, the thoracic kyphotic curvature, in the low back, the lumbar lordotic curvature, and in the sacral spine, another kyphotic curvature. 2 of these are primary curvatures, meaning that you're actually born with them. 2 of them do not develop until infancy or when you're very young. So the ones that are pointing to the back, to the mid-back, and the sacrum, you're born with those. The low back and the neck don't actually develop until infancy, when you start crawling and lifting up your head, and in the low back more so even when you begin walking. So the curvatures are actually there for a reason. They developed as a means to provide humans with up to 10 times more strength to withstand axial compression than would a straight spine. Axial compression being weight from the top down, or weight from the head down towards the hips, such as when carrying things on top of your head, which you maybe don't see a whole lot of in the United States. To what you do see an example of axial compression is in NFL football, when they're tackling with their helmet first, which they are trying to get rid of because it causes severe amount of damage to the neck and to the rest of the spine, and of course concussions and head injuries. So that's just one example. Another focus on this curvatures of the spine is how the thickness of the vertebral bodies is related to them. So as far as that goes, in the lordotic curvatures, which would be in the low back and in the neck, is typically going to be thicker in the front than on the back. So if it's thicker in the front than on the back, and actually it's going to curve like this, and it's the opposite here in the thoracic spine. It's going to be thicker in the back than in the front, naturally causing the spine to curve towards the back side. So the last thing I'll discuss here is the line of gravity in the curvatures. So imagine these curvatures were not twisted up and all out of shape. Just imagine this was a proper curvature, and there's a line going straight down the middle with an equal amount of mass on the front and an equal amount of mass on the back. And what happens clinically or in the real world is that for whatever reason, part of that curvature is modified or changed, and so when that happens, there's going to be a change in another part of the spine. There's going to be an equal amount of change in the opposite direction. So there's going to be compensation, and that can cause changes in balance, changes in posture, and it can ultimately lead to pain and pathology. And next time we're going to go into a little bit more of the muscles and the ligaments and how they are associated with the active function and movements of the spine. Thank you.